All right, welcome back to another episode of Live with Marcel and Kilani. We have another special guest with us this week, Jeremy Ho, and we'll give a little introduction in a second here. But first of all, as always, let us know where you're tuning in from, what city you're in, what time it is for you, and let us know up front what questions you have for Jeremy. As the title suggests, we're going to be talking about leadership and mental health in the workplace. So if you have anything pressing or anything you're curious about, right up front, feel free to put that in the comments and we'll bring that up on the screen to answer your questions. And as always, if anything comes up for you during the broadcast, feel free to put that in the comments as well, and we will answer your questions too. So without further ado, we'll bring on our guest, Jeremy Ho, who is creating an app around mental health. And it's designed, I'll let him talk more about the app later. It's a really cool, really cool invention. But it's an app that's designed to kind of remove or at least step around the stigma that mental health brings, specifically in leadership in the workplace. And they have a very cool way of doing it. It's a way of allowing people to speak with a counselor, mental health professional, without actually them even knowing who the client is on the other side. So I'll let Jeremy take the stage. If you want to tell us a little bit about yourself and what you're doing.
Yeah. Morning, Kilani. Morning, Marcel. Morning, everybody. It's an early morning. It's in Singapore right now. It's about 8 a.m. I believe the weather has been super hot recently. Yeah. So I have the aircon on and everything on. Yeah. But yes, once again, thank you for having me, Marcel, Kilani. Yeah. My name is Jeremy Ho. I've been in the Singapore social service and social enterprise line for about 5 years, but that's excluding volunteer work. I started off working with vulnerable individuals and communities. I'm also very much involved in the public and employee well-being sector. I manage the counseling and mental well-being services under my organization called SomethingNew, which actually Kilani just shared a bit about it, and also a charity called Singapore Planned Families Association. Yep. I find joy actually in this line. I find a bit of value fulfillment. I've learned a lot. And lastly, actually, I feel that this line is very tangible. I can feel the tangible growth within others and myself as well. So that's about me. And that's why I really like this line. And that's a bit about myself.
Awesome. Thank you so much for sharing. And one thing that's really stood out to me that I think is different about you than most people we speak to is, for some context, whenever we have these live streams, I always ask our guests for a little blurb about themselves, kind of a concise 2 to 3 sentences of who they are, what they do. And what I think is really cool is in Jeremy's intro, it wasn't so much about his job, his role, his title, but it was just about being a good human being and making a difference. And I can really see that reflected in the work that you're doing through the conversations that we have. And clearly mental health is a very important topic to you. Could you tell us a little bit about how you kind of got into working in that space?
Yeah, I mentioned that I actually work with a residential care home in my first social experience, my first social service job. It was a lot of shift work. It was a lot of work on the ground with youth at risk, seeing their lives being transformed, seeing them, having a community to actually be involved in. I believe it kind of inspired me to continue the line, kind of inspired me to pursue counseling actually. Yeah. So therefore I picked up counseling and shifted from engineering to counseling. So but just to be a bit more personal, I've grown up in a missionary family actually. And being in the third world countries, I do see different things compared to the first world right now. And my parents kind of inspired me to do this kind of social work line as well. So that's just a bit about me as well. Yeah.
May I ask what as you were saying that, right? What was it that you noticed, living in all of these different countries, that really kind of felt, maybe set you apart, right, from what other people were experiencing that didn't have, those kind of same experiences?
Yeah, I believe education is a very different thing back there compared to Singapore. Singapore, I believe we take pride in our education system. It's a very refined program. But when I'm there, when I started homeschool, in Cambodia for 5 years when I was younger, I realized that things are so different. The issues faced in Cambodia compared to Singapore are very different, and these things motivate me that and sort of I would say, allow me to feel more contented, than maybe possibly other individuals in Singapore. So I believe something I hold and take not for granted is grace a lot. Yeah, grace has taught me quite a few things, and to be gracious in what I have right now is something that maybe it keeps me going. And then I believe to spread that value fulfillment, that contagious feeling to others, especially the beneficiaries that we serve on Something New, the clients that we serve on Singapore at Singapore Planned Families Association. I believe it's something I really want to commit and do. Yeah, so that has taken me far. That has taken me where I am right now.
Yeah. So it almost sounds to me like, a large part of what shaped you, right, was maybe having the opportunity to live a piece of your life with, or have experiences with, people who were just much less fortunate than you were.
Yeah, I would say that. I would say that.
Yeah. And in that, in that environment, what did you learn from them, from people who were less fortunate?
I've learned that they are settled. I mean, they don't they don't really look for the things that we looked at, the things for that we usually look at. Comfort, they're very comfortable with discomfort. They are very comfortable with less. So sometimes I feel less is more, and I've learned that through working with disadvantaged families, even in Singapore. That kind of inspires actually a more contented and simple lifestyle, and that translates, to why I'm here in the mental health industry as well.
Yeah, absolutely. Because I guess there's something empowering, right, in knowing that you can have nothing at all and still be okay, or even still be happy, right, without any form of earthly possessions or anything. I know it sounds like a metaphor, but I do believe, and we see this in our coaching too, is that a lot of the challenges that people deal with really is there because of fear, right? Of fear of not having enough, fear of not making enough money, fear of not, and so as I think as societies become increasingly more affluent, we become increasingly more fearful because the more we have, the more we're afraid of losing, right? And so do you see that as well in kind of your counseling practice?
Yeah, we do see a bit. We do see self-esteem issues. We do see just individuals coming in, clients coming in, speaking and talking and sharing about issues related to a lifestyle which they feel like they must keep up to. It's a rat race here. I'm not gonna lie, and sometimes people feel like they are lousier than others. Sometimes people feel like they need to catch up. And in fact, actually, in counseling, what we do is we professionally facilitate their emotions, and it's okay to to be yourself. Everybody is a unique individual, and that's what we share constantly. We make sure that there's a therapeutic space, a safe space for them to share, a safe space for them to pour out their struggles. But at the end of the day, we are there for their best interests, and should they really require more I would say, motivation or certain modality that can inspire them and push them to their limits, then of course that's when we collaborate with coaching, we collaborate with certain kind of programs. Yeah. So very dominant. Yes, good question. Yeah.
Oh yeah, no worries. Yeah, cool.
Yeah, and in your experience with people who kind of feel they have to live life at a certain standard or meet certain expectations, how have you found that affects their maybe decision or ability to seek out mental health services?
Yeah. Sorry, the question was how do they seek out these services?
How does it affect their decision to? So in other words, do you find that people who have maybe higher status or hold themselves to a certain standard, especially in Asia or Singapore, where mental health is highly stigmatized still, do you kind of see this expectation of themselves, this high standard of themselves, affecting their maybe personal ability or personal expectation of being able to seek out mental health services?
Yeah. Yes, good question. I believe in Singapore, right? We always give this three aspects. Firstly, of course, just like your secondary school, your primary school, in schools they have school counselors, and be it whatever status whereby a student or maybe an individual may come from, their company may have also an external, social worker or external counselor. They won't really want to approach these counselors. This is just regarding free therapy already, and they already don't want to approach these counselors because it's number one, they feel that counselors are snitches. That number one, that their bosses would know. Number two, they feel like if they were a student, they know that their school counselor will have to inform their teacher, and therefore, when their teacher knows, their parents know, so that trust is broken. But to answer more directly this question, regarding financial aspects, Singapore, we don't really have a I would say a very very established counseling framework right now, in terms of how to price the sessions. Yeah, so you do see a very big gap in terms of pricing. Some organizations price one session at possibly $50. Some they price it at 250. So there's a big gap. It's not curated. It's not managed in a very regulated manner right now. So finances is a big concern as well. People of every status, of every SES actually say that counseling could be more for the rich. Yeah, so that's something that actually is being discussed. And lastly, just people feeling that counseling will be something that will diagnose them, and therefore they will be labeled as somebody who is incompetent in society. These are three very very big factors that kind of stigmatizes the name. I believe very dominant in Asia as well.
Yeah, and you mentioned there's this element of people being afraid of seeking out therapy or mental health services because their boss might find out, right? And you mentioned to me when we spoke earlier that you have a lot of research and a lot of experience working specifically with leaders and leaders of higher status specifically, who really struggle to admit to prioritizing mental health or even experiencing some forms of mental illness. In the context of leadership, why is putting an emphasis on mental health so important?
Yeah. I believe from a humanitarian point of view, it's important to help allow people to reach their fullest potential. At the same time, ensuring they don't burn out. It's important because different people have different competencies, at different stages of life. So as leaders, I strongly believe it's important to facilitate that growth in the most appropriate manner, making sure that positive mental health is emphasized, is prioritized, especially like in a first world like Singapore. We face first world problems. Third world country, they face issues such as poverty, malnutrition, but that somehow creates more resilient citizens, somehow, possibly more joyful people, more contentment. But in Singapore, in such a fast-paced rat race, I believe we face first world problems, and that's more human cognitive centric. That's more, for example, depression, anxiety, self-esteem. I do feel that as the country evolves, the leadership should be placing more emphasis, in fact, on mental health. I feel that as long as humans exist on Earth, mental health would be one of the greatest investments and priority in life.
Yeah, and as you were saying that, right? I was thinking about kind of in the United States right now, right? The CDC has coined loneliness as an epidemic, right? With of course growing mental health, and then on top of that, we're seeing kind of the conversation in politics regarding gun control and mental health. Right, and so clearly, and of course, this is at a national level, that that we're seeing a disruption, right, in how people, or maybe a dysfunction, and how people are starting to manage how they can get along in their communities, and in some communities that's completely falling apart. It almost looks like the more affluent we're becoming, the bigger the population, of course, is becoming, the more lonely we begin to feel.
That's so interesting. Yeah.
Yeah, and I was just kind of thinking about from a solution perspective, because of course Kilani and I work a lot with business leaders as well, and my question always is this really a solution that we need to kind of place with governments, right? Like government, is like with their limited resources, regardless of what the country is, right? Politically, they might be able to put some interventions in place, but generally speaking, I think the big solution is in the micro environments that cause a lot of the mental health challenges, right? Like in this case, corporations. Corporations, for example, being able to take on this responsibility of putting the mental well-being of their people first, right? People before policy, and I think what we're seeing is, especially after we're coming out of the pandemic, is that there's a need for that, right? And a growing need, but at the same time, there's also, I think, an underestimation still from a lot of business leaders about the impact that mental health actually has on the bottom line of their company. I think many leaders today are still not aware that there's a price tag to mental health, and it can cost significant, right? There's tons of research that shows that simple things like mental fatigue, low level burnout, like low grade burnout, not even kind of high end burnout. Just all of these kind of things chip away at the productivity of an organization, to a point where mental well-being can cost a company 30% of its revenue, right? And so if you're a business leader and you're listening to this, and you guys are not investing money in the mental well-being of your people, and you're not managing that, chances are you are leaving 30% of your revenue on the table that you're not addressing. And for some companies that can be sizable, right? What company wouldn't want to make 30% more revenue? And especially in this day and age with regards to inflation and all of those kind of things, it's for people like us, of course, it's a no-brainer, right? But I think for organizations, that awareness is still not. That's a blind spot. I think, for a lot of organizations. And the other challenge that I have is that, when I sometimes talk to leaders, they're like, oh, but we do have, we have mental health initiatives in place, and there's buddy systems, and HR is doing courses on resilience, and yet despite all of that, people are still not well, right? And so we're doing something wrong. We need something, something scalable, and we need something that's easily accessible, and potentially, like you mentioned earlier, that is actually not necessarily immediately run by the company, because there are trust issues, and there are these issues of, but what is my boss going to find out, right? That I'm stressed out to hear, and and all of those kind of things. And so the three challenges that you mentioned earlier, cost, trust, and the stigma, right? Exist in corporate life too. Yeah. So I found that really interesting that you brought that up, because I see the same three things happening in the corporate world.
Yeah, and I noticed there was a smile that came up on your face, Jeremy, when the idea of buddy systems or certain mental health interventions came up. What showed up for you there?
What Marcel shared was very relatable. I believe it's about right, what he mentioned, especially companies not being able to, if they don't invest in their people's mental health, they may be seeing actually a drop. They may be seeing actually actually losses compared to profits. I do believe strongly, because we work with corporate clients as well, and I do believe that the market, the EAP market, the employee assistance program market, that we seek to help SMEs, MNCs, it's just been 5 months this year, but we do see a shift. We do see that possibly companies are prioritizing EAPs and initiatives and bespoke programs lesser, because maybe they are trying to cover up for losses made during the pandemic, or there isn't just a priority. It is really about pushing their people right now, that since the pandemic is no longer declared a pandemic by WHO, it is back to more resilient people, back to more competent people, and we just see society going back to the norm, and it's a cycle. I believe I always tell partners and even collaborations, I say, mental wellness business isn't easy. We call it good problem. We call it the good problem because good is because, yes, people don't require these services because they are all functioning at a very positive state. But a problem also because eventually in the long run, I believe we will be facing more impaired individuals, more burnout people, and that kind of affects the workforce. That kind of affects the mood, the well-being, and when that happens, I believe a lot of things take a back seat as well. Not only just people's mental health, but economy.
Yeah, absolutely. Yeah, because you think about it, right? Like, if you wake up in the morning and you're not feeling well, I know it because I actually have a cold this morning, and so I, like, just from having a cold, I already feel it. But when we're mentally, not feeling 100%, we don't perform at 100%. It's just in our daily lives, right? And I think one of the challenges is that, as a kind of first world, culture, right? So what we call the Western culture, in that sense, a lot of people don't even know anymore, kind of how unwell they are, right? Because being unwell is normal, A great example is, if you've ever heard yourself tell yourself that you don't have enough time for something, you are already struggling with some degree of mental health, because you're dealing with overwhelm, right? And how many people in the business world are overwhelmed, and the problem is when everybody's overwhelmed, that becomes the norm, right? Because everybody you compare to, everybody you're talking to is overwhelmed. So it's like, I guess it's normal. And so to then say to yourself, I'm not well, right? Because everybody else in this environment is not well either. That's also going to be a sense of resistance then to seek help, because we think it's the more, we're supposed to be that way. We're supposed to be overwhelmed. We're supposed to be too busy. We're supposed to be all of these things. And I think that is a big message that's also sent by corporations, right? By corporate leadership, is that we still value busyness. We still value, it's a badge of honor to be busy, and it's frowned upon to say, you know what, guys, I have nothing to do today. I'm going to do absolutely nothing today. That's frowned upon, right? And so I think there is this stigma, right, around that hard work is, delivers results, and that, and a successful person is a hardworking person, and the challenge with that is that we ignore the fact that we're human beings, and as human beings, we're not designed to be switched on 24/7. That's that in itself is going to cause a dysfunction, and the only time that reset is going to be able to happen is if corporations are willing to address that, to kind of say, say to their people, you know what, from now on, if you work 1 minute later than your work day, you're not going to get a badge, of honor, but you're going to get a badge saying you're an idiot. And we're going to make sure that you get to spend that time outside of work with your loved ones and family, and you get to enjoy yourself, that we're not going to call you on coming into meetings at 9, 10, 11 o'clock at night, and doing all of these kind of things. That's it's so not necessary in today's world anymore, as you mentioned. And I actually was having this conversation with a senior executive just a few days ago, and I pushed back on him a little bit, and I mentioned to him, I said, every single decision that's made in your company, and by the way, not your company, every single company, is not a rational decision. The decision to make people come back to work 5 days a week is not a rational decision. It's an emotional one. It's an emotion that is driven by fear. By the fear that, people might get too much time off, by the fear that we can't control what people are doing in their workday. By all of these fears that we have as leaders are then transferred onto people by reintroducing these policies that we knew, once COVID hit. And we discovered that people work just fine outside of the workplace, and that they're actually really committed people, and that they don't need somebody kind of like looking over the shoulder 24/7, that they do just fine, and they actually do a really good job, right? But we have this need for control from a leadership perspective. We have this need to lead, that comes from a place of emotion. And those emotionally driven decisions are what is hurting the overall culture and well-being of people, and I find that flabbergasts me, right? Is that that you can have a corporation that absolutely came out on top, right, during COVID, like just because they were able to pivot. And they came out on top because their people came out on top, not because they did such an amazing job leading the company. It was because they had amazing people. And then, coming out of that to then just kind of ignore all of those learning lessons and just kind of say, well, now we're going to go back to the way it was because we like it that way. Right. And it's quite interesting. And I find that it's, I'm as when I started studying neuroscience, I started studying neuroscience with the with understanding behavior change, because I've always been fascinated by behavior change. So I'm flabbergasted from a scientific perspective, because you would say that if a group of human beings have been working together for 3 years, right, in a certain way, and that way is better than the way that they were working before, you'd kind of say, well, let's keep doing what we're doing. But as we can see, the brain, doesn't like change, even if we've been behaving away for 3 years, and then has this tendency to just want to go back to what it was doing for decades before, and it's slow. It shows somebody like me how slow the process of change really is for this world, right? That change, long-lasting change, positive change, takes a long time before people see that as the new normal. Yeah, it's very interesting to me. Yeah.
It is interesting to me too. I resonate with all that you are saying. If I were just to add on, just a quick one on why actually I feel that leaders really place mental well-being at the back seat, and there's a cost to this, both on personal, both on professional point of view. I feel that many leaders are competent, like we mentioned, they are resilient, they're strong. But I believe what distinguishes good leaders and from great leaders is the ability to mirror, relate, one down stance if necessary. It's less intimidating. Empathize, pacing with whoever. Great leaders have that wisdom to play to people's strengths compared to their weaknesses. Because when we concentrate on people's weaknesses, we most likely sway towards trying to transform them into somebody who they may actually not want to become, which then could possibly affect their well-being, their mental well-being. And I strongly believe that many leaders are not trained in the aspect of empathy. It's so simple, but even the simplest training, such as maybe PFA, psychological first aid, they don't know. It brings awareness on how to spot signs of people who are in distressing situations, to actually learn how to converse and engage a potentially burnout individual. Yeah, these leaders don't know. But regarding the costs of placing mental health at the backseat, I just feel like from a professional and organizational level, like Marcel mentioned, there's so much data and reports out there that justifies the return of investment actually by prioritizing mental health in the company. If we do that, it shows actually that companies who do not invest in their employees through EAPs, initiatives such as your counseling, cohesions, or maybe even your welfare days, companies actually end up spending more money paying off employee medical fees, hospital visits, doctor visits. This is just simply because I believe we don't prioritize mental health, and our people get sick and tired, or maybe they act sick. In Singapore, we have this term called "chao keng." Basically, it means act sick, and then from there we get behaviors such as absenteeism, right? Underworking behaviors, quiet quitting, so popular right now. Yeah, but regarding the personal level, I feel that, and regarding leadership, I feel that subordinates will not have a good impression of the leader, possibly for their entire life, which is sad for the leader, of course, because I feel people want to be under a caring but strong umbrella. I heard a saying somewhere, and I just want to end this part about this with this saying. I believe it's so true. It goes a bit like your colleagues will not want to remember who or how much you earn or how much you did for the company, but instead they want to remember you for how much you have helped build them up. And I feel that this is what leadership can be and should be.
Yeah, I agree, and I think what you're it's a conversation Kilani and I have a lot too. It's the difference between leading and leadership, right? And I think a lot of leaders, look at how they're leading their company, And the difference between leading and leadership, right, is that leading is about the individual. It's about the leader. As where leadership's about your people, right? Is about how you're landing your policies and all of these kind of things, how that's landing on your people. And and that's where a lot of leaders fail, because they fail to see the effect of what they're doing as leaders on the leadership, for their people. And that's a very important equation, is we have to look at effectiveness to say, hey, how effective is my way of leading, right? That it translates into a form of leadership that is positive and works well for my people, and there's definitely discrepancy there. And a large part, I also think it also is because of overwhelm and stress, right? Because the human brain is incapable of empathy when it itself is under stress, right? And I think one of the reasons why empathy is such a lacking skill is not because those leaders aren't capable of feeling empathy. I'm sure there's the occasional narcissist, but generally speaking, they're very capable people, of being able to feel empathy. But because they are so stressed out and overwhelmed themselves, their brains don't have the capacity to process that way, right? Because they're in survival mode. And I think that is one of the big challenges, right? It's
like we have a network connectivity issue.
That's all right, yeah.
All right, we'll give them a couple minutes to reload, but
I know.
Oh, there we go.
Yeah, I'm back. Yeah. No, but that's, so definitely I agree with you, Jeremy. Yeah. So that was just what I was saying. So I think the system thought I was talking too long.
I think you've both made really great points, and I've realized there's an underlying theme to what we're talking about here, and that theme being we're pushing for preventative care. Not so much about waiting till the problem is so big that, now people are burnt out, people are sick or faking sickness, but really, how do we stop it now? How do we work with what we have now? Mm-hmm. In our last conversation, Jeremy, you had a great point about the distinction between mental health and mental illness. Could you tell us a little bit about what the difference between those two are and how that could potentially help combat the stigma around mental health?
Yeah, very quickly, I believe the term mental health is super stigmatized, because we ought to acknowledge mental health does not equate to mental illness. That's the first thing. We need to acknowledge that the term mental health possibly is very stigmatized in Singapore, because we have this place called IMH. And those who stay in Singapore would know it stands for Institution of Mental Health. It's a governmental body that handles psychological disorders, where potentially individuals may get diagnosed. But mental health is very much safe. Counseling is very much safe. Individuals, employees, and even leaders, they need to understand that the counseling is a safe space. There are no track records that your bosses can see if you go for EAP counseling, or maybe even outside counseling, external counseling. And counselors in a counseling center actually cannot diagnose people. There's a difference between the psychotherapist and counseling. Like we mentioned before, counseling is just there to professionally facilitate their emotions and create therapeutic moments, which has a very high efficacy regarding human growth. I just believe, I really do believe that everyone has mental health. We have mental, we have health, we have a brain, right? And our brain has a health. And it's whether one has higher positive mental health levels or low levels. And therefore, it affects the functioning of the brain. It affects somehow us digesting and functioning as a human and relating to people.
Yeah, and it's like something I've kind of done historically. I used to work in the fitness industry, right? And so when we would talk about kind of fitness levels, I always would talk about a spectrum, right? You have illness on one side, health in the middle, and then you have fitness at the other end of that spectrum, right? And generally speaking, people slide on that spectrum, right? So, let's say one day they catch the flu, I'm just saying something, then their health goes, to the left side with illness. It's not going to stay there. They're gonna see a doctor, and they're gonna see a medical professional and all of those kind of things. That then slides to kind of more where they're in normal health. And then from there, they're going to manage, however they manage their health, right, is then going to decide whether or not they can start sliding towards that fitness, when they then need to work with a professional that can help them towards that fitness side of being physically fit and being able to do whatever it is that they want to do in life, and have that mobility and strength and all of those things. And the same counts with regards to our mental well-being, right? Is there's mental illness on one side, which is basically a complete dysfunction, right, of our way of operating, and for that you need a healthcare professional, just like you do with your physical health. And then there's mental health in the middle, and then there's mental fitness, right, at the end. And ultimately, right, for a person to want to live in the state of kind of resilience and happiness and fulfillment, that lives on that mental fitness side. It doesn't necessarily live on the mental health side, right? But you have to start there. You have to start on that. Again,
You're fine on our end.
Oh, okay, great. So it looked like my laptop wanted to conk out. Okay, so that's good. So I always use that spectrum to kind of describe it. And if you're not all the way on that left side of where you're mentally ill, it doesn't necessarily mean that you don't want something better for yourself, right? From a health/fitness perspective.
For sure. And Jeremy, you've come up with an amazing solution to this dilemma. Could you share with us a little bit about the app that you have and what it does and how it works?
Yeah. Thank you so much for asking. We created an app for our, and it's our main EAP, Employee Assistance Program call. It's really for leaders, for employees, for even students as well in institutions. It's called SomethingNew. It strives to curb the stigmatization, like Kilani mentioned at the start, of seeking help. In Asia, especially in Singapore, we want to make mental well-being initiatives effective for organizations. Just a quick one. Last year, World Mental Health Day, 2022, October 10. We were invited to hear from leaders of McDonald's, BMW, McKinsey & Co., etc., right? Governmental bodies as well, who spoke on the weaknesses of EAP. And they mentioned that number one, low utilization is a weakness of EAP. And number two, non-tailored initiatives. The word tailored is an important word to take note of. I believe that is why Something New focuses on finding the root cause of poor well-being through providing text counseling first. Text counseling, and then through data collection, through anonymous and credible data collection, I believe we are able to analyze the leading factors of what contributes to poor well-being in a company, specifically and seamlessly with the tech, right? For example, we are able to track help-seeking behaviors, also known as your timing of the employee seeking help, seasonal trends. We can also track the overall data regarding the common mental health struggles and the topics. From there, we introduce bespoke, effective initiatives such as your face-to-face therapy, your support groups, something quite different, and your wellness talks that will target the root cause. Right. So this strategy, I believe, Something New's approach, we like to say that it will be more robust. It will be more tailored. And a lot of corporate clients actually ask our team, hey, what are the popular talks right now? Then we come up with things and wellness talks which are effective, but they may not be tailored to the organization's needs, because every organization is unique, right? They can go for psychological first aid, positive psychology, finding your ikigai, these things, mindfulness, building resilience, etc. Yeah, but at the end of the day, Something New is there to address the poor well-being culture, because I believe it starts from the top. Yeah.
For sure. And where can people connect with you, and where can people get access to your app?
Yeah, anyone can download the app on the respective app stores on their phones. If you're using Android, it's at the Play Store. If you're using iOS, it's at the App Store. The Linktree URL, I believe, which is a one-stop URL, right, for all that you need to know, should be in the comment section right now. Thanks, Kilani. But yeah, anyone can simply sign up, schedule a chat with our pool of therapists regarding text counseling. And if you believe it's so useful to create a positive impact for your company, especially the well-being culture, I believe you can go to our website, somethingnew.org.sg, and we will be in touch with you to provide premium EAP initiatives catered to your organization. We can go on a consultation call as well, no problem. And if you're interested, even if you are just an individual here watching who wants to receive individual therapy not related to your company as well, we do that. Yeah, and it's just feel free to contact us publicly on our website as well. Yeah.
Amazing. Thank you so much for sharing that, and thank you for sharing your expertise and insight around mental health and leadership as well. I think this is such an important topic always, but I think especially now as we're running into a digital age, AI is emerging, things are changing really fast. We're coming out of a pandemic. There's just so much going on and constant change. And I think mental health has risen to the top of the conversation board recently. And while it's still not quite where we'd all like it to be, we're moving in the right direction. And I think your app is such a great way to facilitate that and accelerate the progress as well.
Thank you so much, Kilani. Yeah.
Of course. Marcel, do you have any last closing words?
No, I just want to say, one of the reasons why I think it is so important, Jeremy, that you stick with this work and keep doing it is because it is such an important subject, and it is such an important initiative, and it is only going to become increasingly more relevant. And in that way, we need to, the more access people can get to it in the best way. And that's what I love about your app, right? Is that people can get quick access. It's affordable, it's accessible, it's easy to use. And so I recommend anybody, if you are struggling at this moment in time, or you just want to have a conversation even about mental well-being in your workplace, or you want to kind of say, I am feeling a little stressed, I wonder what's out there for me, click that link tree and have a chat with Jeremy's team, and find out what's all available for you, and you'll be surprised how much support there is for you.
All right. And to all our viewers, thank you so much for taking the time to tune in today, whether you were watching live or if you're watching the replay. And let us know in the comments if you were here live or in the replay. We always like to see that. And if you or someone else is interested in being a guest on our live stream, feel free to either comment yourself, tag them, or reach out to either me or Marcel, and we can get you started on getting set up for a live stream episode. All right. If that's all, we'll go ahead and close up for today. Thank you again, and we will see you next week at the same time.
Thanks, everybody.
Bye.
Bye, guys.